For anyone who's been diagnosed with cancer, they'll have a meeting with their oncologist. The discussion will examine their stage, diagnosis, grade of the disease, and some basic features. But at some point, the conversation gets around to what are my chances? What is the likelihood that I'll respond to the treatment? An honest oncologist will give a realistic expectation. For example, if you have advanced colon cancer today, you will be told that you have a 40 to 50% chance of response to available chemotherapies, and that the median survival, that is the average for most people, approaches 3 years. That sounds reasonable, but if you're 47 years old, you'd like better odds. You'd like to know that the chance of getting better is closer to 80%, and that you could live 5 or more years. Doctors can't provide that today. It's not that they can't, it's that they have no ability to know who's going to get better. You see, these averages, these odds, are nothing more than population statistics. On examination, they're actually a little silly. Because when you say to someone, you have a 50% chance of getting better, does that mean that 1/2 of your tumor is going to go away? Or does that mean that 1/2 of the people that get the drug get better, and they're 100% better, and those who don't get better are 100% not better, or 0 responders? That's really what the statistic tells you. That statistic is a population statistic forced onto the patient as an individual. We don't like that approach. We say that every patient is their own story in the making, and that we should decide which group you fit into before we give you the drugs. So we take each patient's tissue, we dissect out the cancer cells, and we study in the laboratory what causes those cells to die. If it's 5-FU, or irinotecan, or oxaliplatin, or one of the many drugs that are used, then your chance of getting better is 2-fold higher. We take a person with a 30 or 40% chance of response and separate them into one of 2 groups. The good group, the ones that are sensitive to treatment, they have a 60 or 70+ chance of getting better. That begins to sound rather appealing. The group that look resistant to chemotherapy, for whom the drugs don't seem to be effective, they've only got a 5 or 7% chance of responding. Now, neither of those are 0 or 100. It's not a perfect test, but most patients, given the opportunity to get a 30 or 40% chance of response, as opposed to a 70 or 80% chance of response, will take that chance. We suggest patients seek the kinds of treatments that give them 70 and 80% chances of response, and avoid those that give them single-digit response expectations.